Hi, my name is Bob. I had the Stretta procedure about 13 months ago. Prior to that, no sleep. It was causing sleep apnea. I was having afibs, heart problems, and I had Barrett's syndrome. And after the procedure, which I would recommend for everybody that has serious acid reflux, I'm back to being myself again. I get sleep at night. The sleep apnea is gone. It was apparently triggered by the acid reflux, and I've got my life again. So I have a combination of symptoms, and we know that I have acid reflux. We know I have Barrett's syndrome. Know that I was having AFibs due to sleep apnea. Tested positive for the sleep apnea, and all these together, the doctors were trying to figure out how to resolve the issue, and it came down to Dr. Noah concluded. He asked me if I wanted to try this. He explained to me that even though the acid reflux, the actual pH of the acid, was apparently under control because the Barrett's was not progressing. However, the sleep apnea, I was actually drowning my sleep. There was so much reflux, it was in the back of my throat. But I started to have positive results, sleep apnea results, 3 weeks after the Stretta procedure. I mean, I just took my mask off, I removed the CPAP, no more tongue stabilizing device, I was done with it. And the AFib has gone away. I still like to get more sleep, don't get me wrong, but the acid reflux still, it wasn't so much that it was acid was coming up, but I was still having reflux. Well, this has stopped. I tell them absolutely have the Stretta procedure. It's minimally invasive. I read and researched on the surgeries, and the surgeries don't really work. They don't last. If they put stitches in, usually one stitch is broken by the time you go home. By the end of 5 years, all the stitches are out. So your esophagus is, and enlarged again, or your what is the sphincter muscle there, that goes back to its normal size. The other surgery, I heard about a ring being put in, and either way, you're down for about a month after you're done that. When you have stomach operation, even though it's minimally invasive, if you're a physical laborer, you're not going to do that. You'd have to have a desk job. The day of the Stretta procedure, I was in, I was out. It wasn't long. It was a little longer than a regular scoping. I want to say maybe 15, 20 minutes longer. Maybe it took, I don't know, but I walked out of the place pretty fast. Well, now I have energy to spend time with my daughter or my wife. I'm not I got a lump on the couch after I come home from work and don't feel like doing anything around the house. Although I never feel like doing anything around the house. I have energy again. I can sleep 6 hours. My goal is to get to 7. I never really slept much as a kid, but I feel fine. And I recommend it absolutely. My brother has it, and he's got so bad. He's got sleep apnea too, and I'm recommending him for it. And it's worked wonders for me.